Hello and welcome again to the second part of Glad Education series. This is the second of the education session and the last one. This is more so going to talk about exercises and the self-management, the tips and tricks around what you can do to self-manage your osteoarthritis. So welcome. And I must remind you, as I said, this is the second part. So if you haven't done the first education part, please make sure you follow the link down below in the comment section and make sure you watch the first education session first and then you come in to watch the second education session, as there are quite a few graphs and things that might not make sense or you probably might not understand as much if you haven't heard the first session first. So please make sure you go and listen to the first education session before you follow through this education session. So the links are in the comment section below, or also you can find them in the playlist section. So welcome. And also this education session might take about 20-30 minutes of your time. So hopefully it shouldn't be too long, but in case if you're feeling any stiffness, soreness while listening to the session, please make sure you get up and try and walk around and move so you don't get stiff or over stiffness, aches and pain. Also take that opportunity to write down any questions and queries that might arise in your mind so that you can ask us at the end of the session. What I'll also do is I'll leave our contact details, email address, websites and phone numbers at the end of the slide and in the comment section below. So whatever questions you may have, you can ask us, or you can probably bring it into your next session with the physiotherapist. And there we go. All right. That brings us to this first slide of the pyramid, which is mainly talking about the options of what everyone has in osteoarthritis. It is mainly talking about the options of the treatment and the self-management part. What, as I said earlier in the first education session, is if you really look at the green color graph, which is mainly talking about the education, exercises and weight control, that goes through all the way up to the top, saying or meaning that you must try and keep doing each and every aspects of that. So improving your education, trying to come in terms with your osteoarthritis, trying to know a little bit more about osteoarthritis, how to manage it, what to do, when to do, that sort of a things. As well as exercises is very, very important to build up your strength, to improve your flexibility, agility, to have optimum loading in your joints, and also to try and control your weight. So those are the very, very important factors that you must try and do if you are suffering from osteoarthritis. And also make sure that even if you add up any second or third line of treatment, which is any adjunct therapies or pain medications, or you seeing any naturopath or physiotherapist or anyone for dry needling, acupuncture or any such things, please make sure you also keep exercising. So don't give up on those exercise aspect. As well as if you end up having a surgery, which would also require you to do the exercises afterwards. So why not to try and do exercises beforehand? So please make sure that you keep doing exercises all the way through. And that's what this pyramid is mainly talking about. And in fact, in the next few slides, that's what we are going to talk about of exercises, that why one should do the. So when we keep saying exercises, what does it actually mean? Like what is your understanding about the exercises? What do you think? Please make sure you mention in the comment section below what is your understanding about the exercises. But in my terms, what I really feel exercises, or what I hear all the time exercises is, as like, I've seen lots of clients with osteoarthritis and often not with osteoarthritis who comes into the clinic, and if you ask them, or do you exercise? Oh yes, I do a lot of exercise. Like, I go for a lot of walk. I go to the shops every now and again to get the milk or the newspaper or whatever. Or probably I do a lot of gardening. I keep moving around the house. So I'm really active. I exercise a lot. But when you actually classify exercise, or when you try and define the exercise, it doesn't really meet those criteria. So in simple terms, what you're doing, or what I've just mentioned that people always say that you've been doing, that is called as a physical activity. So you've been active, you've been moving around, you're not sitting down, you're moving your joints, you're moving your muscles and stuff. Yes, that is good. Anything is better than nothing, but that is not actually an exercise. What exercise is particularly is when you do something with a purpose. So, or probably at a moderate to high intensity. So let's say, for example, if you have a purpose of losing weight, or you probably want to build up some more muscles, or you probably want to challenge your endurance of agility or flexibility or something, and you try and stretch, or you go for a run or jog, where you're challenging your cardiorespiratory system, your heart rate goes higher, you probably cannot be able to sustain for like more than 20-30 minutes way if you're running at a higher speed or something like that. That's what something is called as an exercise, rather than just walking around your house or walking to the shops to get the milk or a newspaper or something, which will be compared as a physical activity rather than exercise. So I mean, the main intention of saying the difference is, either way it is good. If you're being physically active, it's really really good, and it's important in the sense, if you cannot really exercise, you must try and stay active and be physically active and keep exercising. But if you can, and if you're physically capable, I would really encourage and recommend you to try and exercise with moderate to high intensity, with the purpose of building your strength and trying to load your joints optimally, which would help you to build up your cartilages better and help you to reduce the aches and pain that you're suffering from osteoarthritis. The reason why we should be physically active or try and exercise on a daily routine is because it actually reduces the risk of chronic illness. There are probably about 30-40 chronic diseases that can occur if you're not really physically active, or you've never exercised in your life. Whereas on the contrary, if you exercise, there are lots of chronic illnesses like probably diabetes or osteoarthritis, osteoporosis, chronic heart disease, or cholesterol, high blood pressure, cholesterol. All those things would actually reduce in terms of exercising and in trying to keep your body staying active and fit and healthy. So those are the positives. Like if you really try and talk about the positives as it says in the slides, one of the first and foremost thing that happens with exercise or regular exercise is the risk of high blood pressure reduces in your body. The risk of high blood cholesterol reduces in your body. If you may or may not probably be suffering with diabetes, but the ones who are suffering from diabetes would know how hard it is to control the sugar levels on a daily basis, which can be actually better managed by exercises. So if you exercise, your metabolism increases, and you probably use up or digest or metabolize those extra glucose in your body, and would actually help you to maintain your blood sugar levels. What it also does is it improves your physical fitness. So on a regular basis, if you've been exercising, let's say when you start, you might be only able to walk 5 or 10 minutes at a stretch, but when you keep doing that regularly, that 10 minutes will become 15, and then 20 and 25 and 30 minutes gradually, and that's how it improves your physical fitness. So exercise is a really good way or mode of treatment here in osteoarthritis as well, which is what we're going to talk about next. It also improves your muscle, as you may know, the people who go to gym or probably exercise at home with TheraBands, stretchy elastic bands, or dumbbells or weights or kettlebells or whatever, that it actually improves your muscle strength. It builds up more strength in your body and helps you to lift heavier, or like any heavy objects to push or pull. So that's the other benefit. It also improves the bone density. It helps maintaining your bone density, in the sense, if like you might have heard about osteoporosis. It's one of the chronic disease which makes your bones brittle, really porous and brittle, and increases the risk of fracture as we get older. So whereas exercising has actually shown, there are lots of researches done, and exercising has shown improvement in the bone density and improving that bone weight bearing and joint loading with exercises. It also helps you to build up or retain your cartilage, as we have spoken about in the first session, that what happens in osteoarthritis is basically the cartilage is in between the joints. So imagine when two bones comes together, the grimy, greasy substance in between the two bones, which makes it slide and glide to bend and turn or twist against each other, it's called cartilage, and that's what actually starts wearing off with a lots of pressure and loading. Whereas when you start exercising properly, that optimum joint loading pressure would actually help to regenerate and rebuild those cartilage. So that's why it's also important to exercise, especially in osteoarthritis. Now, what it also does is, as you may know, or you would have heard about trying to lose weight with exercise, which is one of the best ways of doing it, because there are lots of other ways of doing it, following a fat diet or intermittent fasting or a keto diet or something. But exercise, I guess, is one of the best ways of trying to lose weight without losing that food habits of or the food items that you really like or like to have in your daily routine. Whereas exercise would try and metabolize the extra carbs or proteins or extra nutrients that you supplementing in your body with those extra diet. So yeah, exercise is really, really good. What it also does, it helps you to reduce the pain. So it helps you in reducing pain by releasing endorphins, which are also known as a happy hormone, which makes you happy. I'm not really sure if you've tried ever, maybe go for a run, 15-20 minutes run, and by the time you come back, you actually feel you might be exhausted, but at the end of the session, you actually might feel a little bit more energetic and sort of powerful in your body. It makes your body sort of loose, but I guess you would probably know if you have tried an exercise, it would just sort of make you in a happy state. That is because of the endorphins that releases in your body, and that also lifts your mood up. You feel better. If you've probably been depressed or been really stressed or thinking about lots of things, and if you try and go for a run or a jog, or maybe try and go to the gym and do some exercises, or even at home, if you do some exercises, yoga or relaxation or whatever, like stretching and stuff, it would actually lift your mood up and make you feel better, and as what you need in osteoarthritis when you're suffering from aches and pain and stiffness and soreness in your joints. So exercising is really, really important and really good, and that's, I guess, why we all should or must do these exercises on a daily routine. What it means is you're not just going to improve your physical fitness, but also improve your overall quality of life and activities of daily living. Now, when we keep saying exercise, there is obviously a guideline. It's similar to the medication. So imagine if the doctors say, okay, you can just take a Panadol, or you can probably take anti-inflammatories or whatever, but they normally give you a dosage. They tell you how much or when to take, why to take, and those sort of things, and which is exactly same in exercise as well. So when I keep saying exercises, what the normal recommendations or guidelines are that every individual should try and get at least 150 minutes of exercises a week, which basically means if you divide by 5 days a week and have a couple of days of weekend off, would be about 30 minutes of exercises a day, which everyone should or must try and get. Let's say if you haven't never ever exercised and you're not able to do that 30 minutes of exercise to start with, what you can do is you can actually break it into small bouts of 10-15 minutes bouts, and try and do it twice a day, maybe in the beginning, or probably even you're even more fragile and really weak and you can hardly get up and walk. I would say probably just try and walk around your house, walk around the kitchen bench, probably go in from your front door to the mailbox and come back a couple of times a day. In the beginning, anything is better than nothing, as I said earlier, but at least try and achieve a little bit of a moderate to high intensity, which will achieve a bit of your higher heart rate, which would mean that you're working out at a moderate to high intensity level of your exercise. So if you're just sort of walking around in your backyard in the beginning, that's okay. But if you just keep walking at the same pace, same distance every single day, that might not work. So what I'm trying to say is you probably start with, let's say, 5 minutes a day, just walk around your house, and then gradually, eventually, as you feel better or stronger, you want to try and push that limits to maybe double up the time or double up the speed, and try and build up that heart rate, which would actually pump up your intensity as well at the same time. That's one of the best ways of trying to exercise and stay healthy. So doing something is better than nothing. So always try and stay active, and just try and exercise as much as you can during the day, and with an aim of trying to build up to 30 minutes a day. Now, what can you actually do to try and stay active or try and exercise? Anything, as I said earlier, again, anything is better than nothing. So whatever you enjoy or whatever you can do to exercise or try and stay active would be the best. So let's say, for example, you probably don't really like exercising, going to the gym or going for a run or walk or whatever, but you probably on the other hand may enjoy a bit of a dancing. Why not? Or you probably like swimming. Swimming, I guess, is one of the best exercises, especially in osteoarthritis, which mainly helps you to offload the joints in the water. So if any of the other exercises doesn't suit you, I would highly recommend that you probably start with or try at least swimming once a week. Once you start probably feeling a bit better, maybe trying to join some aerobics or aquatic strengthening classes in a way, because as I said, it's highly recommended and it's one of the best ways of trying to exercise. But at the same time, also don't forget, you need to strengthen your muscles. You also need to build up your cardiorespiratory endurance and everything, which would come with the other modes of exercises as well. But any other exercise, like, cycling, swimming, running, walking, dancing, hiking, a bit of aerobics, Zumba, Pilates, playing any sports, like, you probably might enjoy social tennis or social cricket or social soccer. Most of the councils have got small clubs and seniors games happening nowadays. So probably try and speak to the local community and see, like, what is there for you and what you might find. You make some similar friends and, like, you probably go out for a walk together, try and exercise together, or probably join the local gym. Most of the gyms nowadays have started seniors classes. There are a few group exercises which is happening in and around the area, or probably come and speak to us. We might be able to guide you through. But as I said, there are quite a few programs that is happening around the area. One of them, which is called OBS, Older But Stronger, and the other one is called as a Living Longer, Living Stronger. They mostly happen in the gym, and they are for anyone about the age of 60 who is suitable for exercising in the gym, unsupervised to supervised. And I believe there is personal trainers who guide you through the exercises in the beginning, and then frequently have one-on-one sessions with you to take you to the progressions of the exercises. So there are many ways of trying to stay active and try and exercise, and that's what I would highly recommend. As I also mentioned, I guess, in the previous session, in the slide, that even for the doctors, they study, like, so there is actually a guidelines what the doctors follow, the GPs follow here in Australia, which is called as a RACGP, Royal Australian College of General Practitioners guide. And that also actually recommends that anyone and everyone who is suffering from osteoarthritis should be actually offered exercises as the first point of treatment. And then if it doesn't work, that's when secondly you probably try and do some pharmacological treatment. That means taking medications, cortisone injections, or non-steroidal anti-inflammatories, NSAIDs, or any other sort of an adjunct therapies recommended by the doctors. But why exercising is very important in osteoarthritis is, I guess, we have been talking about in the first session as well, but I would like to remind you again here in the second session that it is really important to exercise, especially with osteoarthritis, to maintain that optimum joint loading into your joints. So if you remember from the first slide, and if you don't, I'll just probably quickly rehash this. But I would also recommend, if you haven't watched the first session, please make sure that you take time out and watch the first section. The link is in the comment section below. But what the reason is that why you should be exercising with osteoarthritis is because the cartilage in between your joints, so in between the joint line, which gives you the softness or the lubrication to move around, actually starts wearing off with constant pressure and heavy loading. But when you try and exercise optimally or with optimum load on your body or on your joints, that actually helps you to build up better pressure to recycle or regenerate those cartilages, replenish those cartilages from that synovial fluid occurring in the joint. So as you can see in the slide here, that there are two bones coming together. There is a blue color lining, which is called as a cartilage, and there is a fluid in between the joint that is called as a synovial fluid. and there is a joint capsule which is covering the whole fluid. Now, if you remember again from the first slide, each and every part of the joint gets the blood supply and the nerve supply except the cartilage. So the cartilage actually relies on that pumping action to replenish that nutrition into the cartilage itself. But as soon as the cartilage and the gets replenished, or the exercises are happening into your joints, what it does, it also improves the flexibility of the joint. It improves the range of motion of the joint. It helps you to improve that stability and the joint function. So improves your walking, your moving, you're getting up and down from the chair, or getting up and down from the floor, going up and down the stairs, getting in and out of the bed, getting in and out of the car, and those sort of things. So in short, it helps you to move better, to do things better, and also improves your confidence. As at times, like, people with osteoarthritis, they lose that confidence, and they probably lose or have that fear in their mind that they're going to fall, or probably have that knee give away and they'll fall. So that's why it is very, very important to keep exercising and to try and keep moving as much as you can whenever you can. Right. Now, when we say so much things about exercises, it is also really important to remember or to know how you should be exercising. The reason why is, for someone who doesn't exercise or doesn't know much about exercises, I guess again the key word is anything or something is better than nothing. So please make sure you try and do as much as or whatever you can. On the other side, what is important is when you actually know, or you try and take that opportunity to try and exercise properly, the important part is how you should be exercising. So you want to try and coordinate your joints properly. You want to try and make sure that, like, you loading your muscles properly, you're loading your joints properly, you have that proper confidence, proper angle alignment of your joints, the biomechanics working right. Otherwise, you might end up in more aches and pain than getting better. So that's why it is very important to try and get some guidance and supervision from the physiotherapist to do the exercises properly. And especially in the beginning, when you start out exercising by yourself, it is very, very important to have that feedback as well, that if you're doing it correct or wrong. So please make sure that you go and see your physiotherapist, or feel free to come and see us. I'll leave our contact details in the comment section below, or at the end of the slide. So please make sure you don't hesitate to come and see us if you're suffering from osteoarthritis or any other physical conditions. We'll be more than happy and excited to see you in the clinic, and be as well as excited to answer your questions if any. Feel free to send it through and send us an email. As I said again, so it's very important, to make sure that alignment, when you're exercising, that biomechanics and the alignment is correct. So for example, let's say if you're driving a car and if the wheels are not balanced or not aligned, what's going to happen? The wheels would start wearing off from the outer edges or the inner edges, and that's why often every minor or major service you go to the car mechanic, you try and get those wheels aligned, and that's how it sort of works with your hips and knees. So please make sure you go and see a physio if you are not really sure, if you don't feel confident when you're exercising. Again, as I said earlier, of the dosage, that how and why you should be exercising is equally important as how much you should be exercising. Because let's say, for example, if you're taking some pain medications, and if you're not sure of how much pain medications you're taking or how long you should be taking, you might end up having some adverse effects. And it's exactly same as with the exercises. So you also want to make sure that you have the right dosage of the exercises. So here in GLAD, what we normally recommend to start out with is at least 2 exercise sessions once a week. Each session would be around 60 to 70 minutes, depending on the pace and the capacity or the confidence of the person when you're exercising. And once you start getting better, you can probably do up to 3 to 4 sessions a week. But at least in the beginning, I guess maybe 2 sessions to start with, and try and do that at least 6 to 8 weeks in a row. So that's when you know if you're building up more confidence, if you're building up more strength and flexibility and stuff. And once you've done that, then slowly, gradually, you start building up more strength and repeating more sessions more frequently during the day, and you build up more strength. Also, progression is the key. So every 6 to 8 weeks, I would say, if you're doing it yourself, please make sure you catch up with your physio, or ask them for the recommendations of the progression of the exercises of what you're doing. Also, make sure you don't do too much too soon, because what happens is sometimes you are really, you might get really excited or motivated to try and exercise, but that gradual progression or the graph is really important. So you don't end up doing too much too soon, because what will happen is you'll probably burn yourself or waste your energy by doing too much in the early phase, where your body is not able to cope or cannot really take that much exercises or the load, and you might end up having more aches and pain than getting better, and leading to dissatisfaction or probably give up the exercises. So please make sure you start at the lowest bottom level possible, and then gradually, as I said, every 6 to 8 weeks you do that progression. So you're not just maintaining that optimum load or the pressure on your joints, but it also building up that confidence and that strength in your muscles, so which helps you to build up more like regeneration cycle happening in your joints, and build up more strength and flexibility in your joints and your body. So please make sure to not do too much too soon. Consult your physio. Don't hesitate to ask them any question. No question is a silly question. So make sure you take that advice and do that guided supervision exercises sessions to start with, so that you know what is the best thing for your joints. Because again, I must say, the benefit of these exercises is not like, I mean, it's really good. It's not like any other exercises that you go and do at the gym, that everyone does the same exercise. These exercises are actually really modifiable and adaptable for every individual. So you can actually modify to suit those individual needs, rather than the person has to, most of the time that happens, like, you go to Zumba class or aerobic class or something, you have to adapt to the exercise, you have to modify yourself to try and cope to the class. Whereas here in GLAD, what we do is we actually change and modify that exercise to make it suitable for you. So it's, I guess, one of the best things about the GLAD exercises. What might happen is, when you do those exercises, you may get a bit of a pain, which is okay. I guess here, the saying "no pain, no gain" applies, but not always, I would like to say. So make sure, I mean, I guess you might have a little bit of pain, but you need to make sure that it's not hurting you or bothering you too much. And when it actually comes about pain, what we normally follow, or what we've been taught, I guess, is there are two simple rules to remember about the pain. The first one is, pain is okay, it's acceptable. So it's absolutely fine if you have a little bit of pain when you're exercising. So if you see the graph up here, there is a scale saying from 0 to 10, where 0 is no pain and 10 is the worst pain ever, unimaginable pain at 10. And let's say if you're exercising, if you're trying to load that joints, you might have a little bit of pain happening in the joint, which, let's say, would be around 2 out of 10. That's fine. That is called as a safe pain. Or let's say about 3 out of 10. That is called as an acceptable pain, which is absolutely fine. But anything more than that, which is probably taking you into the intense or a little bit higher than the moderate zone, which I would classify as the damage. So make sure that you do not want to damage your joints too much when you're exercising. So a little bit of pain is okay. That's where the saying, as I said, no pain, no gain occurs, and it's true. But as soon as you start going through that extreme pain, it's not good. So that's where you want to step back a little bit and try and rest. The second rule is, so let's say even if during the session you reach that sort of a borderline of moderate pain, it's okay. That's where you stop and you come back. So you want to rest, and give it a rest about 24 to 48 hours, and see how you feel afterwards. If you're feeling absolutely fine as you started the day before, it's normal. So for example, let's say today I'm going to do these exercises. I'm feeling 0 out of 10 pain, and I started exercising. I feel 2 out of 10 pain. That's fine. at the end of the session, obviously I'm going to give it a day or two off, and then when I start again on the third day or after 2 days, when I start the exercises again, if my pain is again at 0 at the beginning, that is absolutely fine. Or probably around 1 or 2, it's absolutely fine. But if the pain is constantly at 4 or 5, even after the exercise or even after 2 or 3 days of the exercises, that's when you've done some damage. And that's when you probably want to seek some advice from your physiotherapist or your doctor. So please make sure you consult them and see them rather than keep pushing yourself to try and exercise. Oh, no. There is the saying, no pain, no gain. You need to keep pushing and you need to keep trying these exercises. That's only when you're going to get better. No, you actually might end up causing more damage onto your joints, and that's why you want to make sure you don't push yourself too much and you probably try and take some rest. Right, now I'm sure you would say probably trying to speak about exercise is actually easier said than done, and I absolutely agree with that. There comes lots of barriers with um, trying to say to exercise, and let's try and speak about those barriers and try and understand what are the barriers to exercise. Now, normally when I ask people what are the barriers that you have or you probably have come across when I've prescribed you some exercises, and most of the time people come back and say, oh, I really wanted to do those exercises but I don't have time. I guess that's probably an excuse, and it's one of the silliest excuse, because if you're really keen to exercise and if you're really keen to make your body fit and strong and better, and you don't want to suffer that pain, you have that time. You just probably ignore it. It's not on top of your priority list. See, it's simple as that. You just have to make it a priority, and you have to find that time out of your daily routine to try and exercise. Because if you don't, it's just going to be an excuse, and you're probably going to lay it off for tomorrow and tomorrow and tomorrow, which will never come. So I guess time is one of the silliest excuse to me. It might happen that you are probably very, 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 very busy, but all I'm asking is probably to start with 2 days a week. So, and if you're not able to find that 2 hours out of your whole week for your own body, for your own good sake, I don't think there is anything else that you can probably do to try and help that pain or to try and make it better, except taking medications and probably end up getting the worst case scenario and maybe having a surgery done. So I guess you probably need to sit down and understand the benefits of exercises, and to try and avoid surgery or to try and take regular pain medications. Exercise is giving you an opportunity to try and get better and improve your joint range of motion and functions and reduce that aches and pain that happening in your joint. So I guess the benefits outweighs the excuses here, especially about time. I guess motivation could be the second factor that people often complain about. That they probably lack that motivation of exercising. Where I guess you probably just need to find maybe a group classes or similar cohort groups where you can probably join and socialize a little bit. As I said earlier, there are lots of councils who are running social groups nowadays. There are lots of gyms where people have older but adult classes or living longer, living stronger classes. And most of the physio clinics like us and in the community, we run lots of group classes for the seniors and other age groups as well to try and exercise. We run GLAD classes, we have hydrotherapy classes, we have seniors move for mobility classes, steady as you go classes for the people, those who are suffering from balance issues and coordination issues. So you probably just need to go and find out, there'll be lots and lots of options for you in the community out there to try and exercise. So motivation would definitely come if you sign up to something, and you would probably be pushed a little bit in the beginning to start doing something. But once you start doing exercises, I'm sure your mood will lift up and your pain will reduce, and that would actually be more than enough to motivate you and excite you to try and keep continuing the exercises. The other problem, I guess number 3, what it says here is the results, is often an issue, a barrier, where people don't see the results as much. But I guess the problem is not really the results. The results are there, but I think it's the goal settings is the problem, where most of the people start, they have the highest goal or the biggest goal that they want to achieve. They don't really understand that that is the ultimate goal, that what they're going to achieve. And they need to set up some small goals or steps to reach or to achieve that highest goal. So for example, when, let's say in terms of osteoarthritis, when people have this aches and pain and they hear about GLAD, what the first thing that comes to their mind or they understand is, oh yes, I'm going to try and do this GLAD exercises and that's going to take my complete pain away and I probably won't need the surgery at all in that 6 to 8 weeks, and it's a curing exercise. No, that is actually wrong. What GLAD does is, yes, I would say it is one of the best exercise programs, and it will actually help you to try and avoid surgery, and it will make your joints feel better. But that is going to happen in due time. It's not going to happen in that 6 to 8 weeks. The 6 to 8 weeks, what we are offering is actually an education and exercise program that you come and learn, and those exercises, you adapt to those exercises and you try and keep doing them ongoingly for at least 3 to 6 months, and that's when you actually see really, really good results. So in the 6 to 8 weeks, you would probably just see the minor results, really small results, where you feel better, the aches and pains have reduced, you walk better and stuff. But it's not actually a curing program in that 6 to 8 weeks. You'll have to keep doing that constantly over probably 6 months or a year to try and get most of the benefits of the exercises. And also remember, once you stop, you probably will have that risk of osteoarthritis progressing again. So you probably want to keep continuing that exercises for the rest of your life. Similarly, for another example, let's say the most common thing that people do is the weight loss. So let's say someone has a really high body weight and they probably want to lose weight. They have the aim of losing 10 kilo, 15 kilo. They start on a diet, they go to the gym, they try and work hard, they do lots of different things, but at the end of the 10-15 days, they had the goal of losing that 10 kilo and they've hardly lost 1 or half a kilo. That actually demotivates them, and they start feeling really depressed and lose the hope that, oh shit, it's really hard, it's not going to happen. But the reason why, as you can see, as I said earlier, the expectations are really high. So if you think of, yes, my ultimate goal is to lose that 10 kilo, but every week I'm going to try and lose that 500 grams and I'm trying and keep consistent efforts, that's when you probably would be able to achieve that goal. So I think that's where people miss a lot. So results also play a big role here. And I guess when you start achieving or about to achieve that goal, give yourself a reward, probably acknowledge that efforts, probably at least a pat on your back, or maybe give yourself a reward of something that you've been waiting for, probably buying yourself a Fitbit. So that would encourage you and motivate you more to try and do more walks or more steps during the day, or maybe a chocolate if you're diabetic, or something as a treat to yourself or a reward to yourself if you have been trying to eat good and trying to control on that sugar intake. So something like that, so achieving results would become easier and would be motivating once you set up small goals or step goals to achieve that ultimate goal. The next one barrier is support. Support can also be a really big issue, that often people complain they don't really have that support from the family or the friends. They feel isolated. They don't really see the benefits of those exercises because people don't really support them. I guess again, in that sense, you probably can join the group classes where you have similar like-minded people. You would see other people encouraging you, motivating you. You'll have the social aspect where you can see other people as well and have a good chat about or something, probably catch up for a coffee or something afterwards, after the classes, and trying to find the support. And I guess if it's your family or friends or someone who probably doesn't understand the importance of exercise, please make sure you share this video to them. And while I've said that, I'll also remind you or recommend you to make sure you share this video anyway. Even if you have the support or not, please make sure and support us at least. So please make sure you share this video, like or subscribe, and comment into the comment section below. But yeah, if you probably lacking that support from your family or friends, make sure you share this video to them and you ask them to come and see us if they don't really understand the importance of exercises. I guess knowledge also could be a barrier, but I'm hoping by the end of this session and the first session, you've at least gained that enough knowledge of exercises and the importance of exercises. So I don't think this is going to be a barrier anymore. And the structure, which is what we are offering in the GLAD program, so the structure probably might not be any barrier anymore. But yeah, structure could be a barrier. Like, when you're probably trying to work out on your own and you don't really know what exercises to do, when to do, how to do it, that sort of things can be a problem. So I guess I would suggest you to go and see your physio, come to us. I'll leave I've said that earlier, I'll leave our contact details and phone numbers and email addresses in at the end of the slide and in the comment section below. So make sure you contact us if you're really looking for a proper structure of exercises and looking forward to join the GLAD exercise program. But yeah, I hope you probably improve your knowledge at the end of this and you try and start exercising as soon as possible and get the benefits of the exercises after this. Exercise is a very, very important role. So I guess now, so far, you would have probably understood the importance of the exercise, but also to understand that it is very, very important in terms of osteoarthritis. It is not going to wear off your joints if you keep exercising. It is actually important to keep exercising, and one must keep exercising because it is going to take a lot of damage to damage your cartilage in the joints. So just exercise is not going to damage your cartilages anymore and not going to give you more arthritis. Also, you probably, if you do not exercise, that is actually going to increase your risk of arthritis in the joints rather than exercising. So try and stay active and be active as much as you can. The coping strategies. What happens is sometimes you might not be able to cope better or enough. And if that happens in terms of exercises, so if that happens when you're exercising and your body's not coping enough, probably stop that activity. Give it a break. Give it a day or two off and see what happens, how things goes. On the second step, what you can do is once you've had a couple of days break, you can probably start to try and do those exercises again as prior. And if it still hurts or if your body is not coping, maybe try and do things differently. Change the pattern of the exercises you've been doing, or change the sequence or the frequency of the exercises that you've been doing, or maybe try and completely change the type of exercise you've been doing. So if you're doing aerobic exercises, maybe try and do some calisthenic exercises or probably strengthening exercises or aerobic your aquatic exercises or something, or maybe go for a walk or a cycle or something. So try and change that type of exercises if possible rather than giving up altogether. Those are, I guess, are the strategies of trying to cope with the exercises. Maybe also might help, to try and stay active by lowering your demands, lowering your demands on your body, lowering your demands on your joints and stuff. Probably trying to get more sleep, trying to divide those activities of your daily living into smaller parts. If you, let's say, have to cook for 5 people and you're cooking a really big meal, and normally as we do, cut it into steps and follow through similar way you can probably exercise. So cut it into small steps and try and exercise, but try and stay active by taking maybe frequent breaks and stop and start activity. Please make sure you try and stay active. So I guess those are the tips and tricks that you can do. But some of the self-management tips, I think I've said that earlier at the beginning of the slide, that make sure you try and take time to walk around and move around at least 20-30 minutes, because that's when most of the people complain they feel stiff. And I guess that's one of the most common self-management tips, that do not make sure you do not sit or stand more than 20-30 minutes. Keep moving, stay active. Also reward yourself, as I said earlier. Give a pat on your back or probably treat yourself with something what you need, or take charge of your own problem, because at the end of the day, it is you who is suffering, and it is you who would know if it's getting better by exercises. So please make sure you take in charge, and you would start seeing those benefits. Also, listen to your body. If it's hurting too much, try not to push too much. If it's feeling better, maybe step up a little bit. If it's hurting, I guess maybe try and do some relaxation techniques, yoga, or just listening to some soothing music or relaxation music or something. But also make sure you keep checking the range of motion. You want to keep an eye on how far you can bend your knee, how far you can straighten your leg or kick your leg up or backwards or sideways, because often people forget doing those and end up or find themselves in a really stiff position. So make sure you keep checking those range of motions on your hips and knees. Also, trying to stay strong. One of the first and the foremost thing I guess I've said in the first slide as well as in this slide is to try and aim for the optimum body weight, to try and lose that weight if you're carrying excessive weight, and also maybe trying to avoid the limp by using some supportive devices, maybe a stick or a walker or a brace or some orthotics or any other such devices to try and avoid that limp in your legs. Because when you start limping, all of a sudden or soon enough, you will find the opposite leg would start hurting more because you're putting too much pressure on the other side as well. So make sure you definitely try those self management tips. But at the end, I would like to conclude with saying, like, there's definitely lots and lots of benefits, as what I've experienced myself by running glide classes over the last 2 years. That people often say, like, they feel such a great benefit out of it. Like, they have been taking less sick days, they have been taking less medications, they feel good, they can get in and out of a car easily, they can get out of bed easily, they can probably bend and get at the bottom drawer of the fridge, they can do lots of gardening, go for long walks, hikes and stuff. So the results are there. It's just a matter of time, I guess. You probably just need to hang in there and it will pay off at the end. The only person who would know is you. So if you haven't tried, I would highly recommend to start doing those exercises and at least give it a shot. And at the end, I would like to take this opportunity to thank you all, and I would again remind you that I'll leave you my contact details here. So please make sure, if you haven't watched the first education session of the GLAD, which is mainly talking about the understanding of the osteoarthritis and the treatment part, please make sure you watch that video. And this is the second part of the video, which is mainly talking about the exercises. And yeah, if you have any questions, feel free to come and speak to us, give us a call, make an appointment. Happy to have you. I should say, I'm glad to have you and glad that you could make it so far. And thank you again, and look forward to see you at our GLAD program. All right, thank you. Goodbye.